What is the mechanism of action for UTI antibiotics? Imagine fighting off an unwanted guest in your urinary tract. That's what antibiotics do when you have a urinary tract infection. They target bacteria in specific ways to stop the infection and help you feel better. Different antibiotics work in different ways, but all aim to either kill bacteria or stop them from growing and spreading. One common way antibiotics work is by attacking the bacteria's cell wall. Bacteria have a protective layer called the cell wall made of peptidoglycan. Antibiotics like amoxicillin and cephalosporins bind to enzymes that build this wall. When these enzymes are blocked, the wall becomes weak, and the bacteria burst open and die. Clavulanate is often added to some antibiotics to block bacterial enzymes that would otherwise destroy the antibiotic, helping it work better. Another way antibiotics fight bacteria is by stopping their DNA from copying. Fluoroquinolones such as ciprofloxacin target enzymes called DNA gyrase and topoisomerase Roman 4. These enzymes are essential for copying bacterial DNA. When these are blocked, bacteria cannot multiply, and the infection is controlled. Some antibiotics interfere with how bacteria make proteins. For example, aminoglycosides and tetracyclines attach to bacterial ribosomes, the machinery that makes proteins. Without proper proteins, bacteria cannot grow or survive. However, these are less commonly used for urinary tract infections. Other antibiotics, like trimethoprim sulfamethoxazole, block the bacteria's ability to produce folate, a vitamin they need to make DNA and RNA. This dual action stops bacteria from growing and kills them, making it effective against common urinary pathogens. Emerging approaches also focus on preventing bacteria from sticking to the lining of the bladder. Bacteria use hair-like structures called pili to attach and form biofilms. Some new therapies aim to block these pili, making bacteria less able to cause persistent infections and easier for antibiotics and your immune system to clear. In the context of bladder health and bladder cancer, treating urinary tract infections properly is very important. Repeated infections can cause inflammation and damage to the bladder lining, which might increase health risks over time. Using antibiotics correctly helps clear infections effectively and reduces the chance of resistance, which is when bacteria no longer respond to treatment. Choosing the right antibiotic and how long to take it depends on many factors, including the type of bacteria causing the infection, how severe it is, and your overall health. Healthcare providers consider all these factors to give the best treatment plan. Remember, always consult a healthcare professional for personalized advice. In summary, antibiotics work by disrupting bacterial cell walls, DNA replication, protein production, or metabolic pathways, helping to eliminate the bacteria causing urinary tract infections and supporting overall bladder health.